flag And with that, we'll need to recess the joint session meeting and open a public hearing for the lease with the Pulaski County Courthouse Budget Corp.
Good evening, everybody. The citizens of Pulaski County, Indiana are hereby notified that the Pulaski County Board of Commissioners, the board, is considering the renovation and equipping of the courthouse facility operated by the county located at 112 East Main Street, Winamac, Indiana, collectively the project. The estimated cost of the project will not exceed $12,750,000, or a portion of which will be financed by entering into a lease with the Pulaski County Courthouse Building Corporation, the building corporation, or other funds as they may become available. This is the first of two public hearings on a preliminary determination to enter into a proposed lease between the building corporation as lessor and the county as lessee to finance all or any portion of the costs or all of any portion of the project. The proposed lease will relate to all or any portion of the renovation of the courthouse to be operated by the county. The lease payments paid by the county under such lease will be paid in whole or in part from ad valorem property taxes levied and collected on all taxable property within the county. Following the public hearing held on next Monday, the 21st of August, 2023, the board expects to consider the adoption of a resolution making a preliminary determination on behalf of the county to enter into the proposed lease to finance all or a portion of the project. As a part of these lease rental and bond issuance processes, a petition to be signed by a minimum of 50 landowners was distributed and collected and then submitted to the county auditor, who I believe verified 79 signatories. Commissioners may now open the hearing for public comment.
Okay, we'll open up for any public comments. Hearing none. Hearing anything from around the table? Okay, I would need a motion to close the hearing.
Make a motion to close the hearing.
Been moved and seconded. Any other discussion? It's good to see that it is finally capped because it has continued to grow about $2 million. Okay.
And then there, as I mentioned to you before the meeting, the architect has been working with the contractors on a couple of places where they may be able to include something that would be ideal but not absolutely necessary as add alternates, so that if the bids elsewhere come in lower than expected and or those do, there's room for it without bringing the project up, but we don't need to include them if we can't justify that cost.
Any other comments? All in favor, say aye. Aye. Okay, now we will reopen our joint session. Nathan, once again.
Yeah, just a couple of quick updates on the various construction projects we have going on. As far as this courthouse project goes, we anticipate letting bids for the project during the last week of September, with the submission deadline to be on the afternoon of Monday, the 6th of November, and the bid opening to take place at the Board of Commissioners meeting later that evening. It is our expectation that we'll ask the board to schedule a special meeting on either Monday the 13th or Tuesday the 14th of November for the awarding of bids on the recommendation of Ton and Blank. Any questions on the progress of the project otherwise? We do finally have a deadline in sight. At this point, it's just little cleanups of decisions. Everything major has been either decided or, like I said, is one of those like situations where we might have a base and then an add alternate depending on the cost, so that we can go for the Cadillac if the budget allows it, and we can settle for the Buick if it doesn't. On the roof of this building, the replacement is done. But we have not yet quite closed out the project. Firestone has issued the 20-year warranty for the roof as installed. They've been out and inspected it. Architect is just waiting on a few answers from Ton and Blank to the last of his questions regarding punch list issues before he's ready to sign off on the last pay application. And then on the Justice Center, the very last component of that project is finally moving forward. The company that will supply the panic alarms in the Justice Center have one of our radios from dispatch to program it so that the buttons can be connected to the system directly. However, they have also been in need of some system information that only rowing can provide, and I've been having some communication issues getting an answer from rowing. RB Walters did volunteer to intervene to connect New Age Telecom out of LaPorte with rowing. I am not sure at this point if he's been able to make that connection. Still waiting to hear from him or Chris at New Age. But everything the county can do on that element is done at this point. Any questions on the Justice Center there? All I have for you. Thank
We
you.
have a meeting with rowing on Friday, so if you haven't had any success, let us know. Anything else for Nathan? Boards? Other guests, Carrie?
Make sure I'm adjusted here. Okay. Hello, good evening. For those of you who don't know me, I am Dr. Carrie Cabell. I'm the CEO of 4C Health. Annually, I present to the commissioners, so I see their faces. This past year, I did send an email to all of the council, but I was outreached by Sheila. Is that okay? Asking what does 4C do, formerly 4 County. So I suggested that maybe it might be a good idea if I walk through that with everybody together. And so I appreciate you having me here tonight to do that. There's really 3 questions that I'm going to answer for you tonight. That is, what do we do today? And basically where we have come from in that process. Understanding the relationship between community mental health centers, county funds, and the state and federal Medicaid program. And then also understanding Pulaski County in the context of the state and national behavioral health workforce. So to understand what it is we do today, it is a combination of clinic services, telehealth services, embedded services, which mean we put our staff out in the community, and I'm going to explain that, leased services, community-based services, crisis services, and school services. In our clinic, and we have a health campus with Pulaski Memorial Hospital, we provide therapy services, psychiatric medication services. Those therapy services are for behavioral health and substance use in the office and also through telehealth. There is such a shortage in the state and in the country that rural areas would have almost no workforce if they were not leveraging telehealth. In addition to that, leased services. Actually, Pulaski Memorial Hospital leases time from our chief medical officer in order to provide the medical directorship for the senior care program here in Pulaski County. In addition, it is our nurse practitioners in partnership with Pulaski Memorial Hospital that provides the medication services to those seniors being served through the senior care program. And Pulaski Memorial Hospital leases a therapist, a licensed clinical social worker from us. In addition to that, for embedded services, we have staff in all 3 school corporations serving Pulaski County. And I say 3 because there are Pulaski County students who are in the Culver schools. And so we include that in our count of serving Pulaski. And these staff are not kind of in and out. They are assigned to be at the schools all day long. That is their primary assignment, to serve those students referred, identified, and consented by the parent to receive their mental health services at school. 2 of those school corporations also have a student support program with us. That's a contract to ensure that students can have up to 3 sessions free. That helps because community mental health centers predominantly serve Medicaid and HIP. That's what we were built to serve. And so when you need to serve somebody with commercial insurance, that student support program can help. 2 school corporations we also partner with in order to provide the services alongside criminal justice partners for the truancy diversion program. We also offer some early substance use prevention services within the school corporations. We have peer recovery specialists that are going here to the Pulaski County Jail in order to run peer recovery groups on Mondays and Wednesdays for males and females. When referrals, we have referrals, we are providing services to the Family Treatment Court and the Vet Court. Again, that's as needed based upon referrals. In community-based services, we take referrals from the Department of Child Services, and we also provide home-based services. So these are services that we're providing in people's homes here in Pulaski County. In addition, we partner with a local church. I'm fairly loud. Can you hear me okay? Okay, all right, I'm just gonna move this off to the side. We partner with a local church, and then when we have sufficient referrals, we run groups such as intensive outpatient programs for recovery services, substance use recovery, parenting, and introduction to recovery for those who are in the need for early intervention stages. Unique to Pulaski County and 3 other counties for us that no other entity or counties in the state have at this level, we do mobile crisis. We have 2 people on call 24/7, 365 here in Pulaski County to respond to law enforcement and the local ER if a mental health or substance use crisis presents itself. So there's a phone number that the local law enforcement can call. Our staff dispatch, go to where they are, I see a shaking of the head, and help triage to get law enforcement back to the job of public safety and not doing the job of mental health. Okay, so these are our first responders, much like paramedicine and law enforcement. Our local emergency room will also call our mobile crisis teams in order to facilitate any type of need for addressing a crisis mental health service. Residents of Pulaski County also utilize our crisis stabilization unit, which is almost, I would call it an extended stay urgent care for psychiatry issues, and our inpatient unit, which is currently in Logansport. We also have grants presently that help fund free trainings to the community for mental health first aid and also suicide prevention, question, persuade, and refer. To date, we have trained 110 people. We're only in the first year of a 4-year grant. The goal here is, again, because of the gross behavioral health shortage in our nation, we have to be able to train each other and how to respond and identify people who might need services, and additionally provide lay people the skills to respond, because not every situation requires intensive behavioral health services. We also sponsor events that are mental health related. So upcoming in this next month, we are sponsoring what are called the Get Schooled tours at the schools that allow then for the schools to collect data and engage the students in positive mental health awareness. So what does this all mean in terms of the total volume of service that we do here in Pulaski County? Annually, we serve roughly around 500 residents. Date, in the last several years, we are providing over 20,000 services annually in Pulaski County. To give you some context, in 2018, we were providing around 10,000 services annually, and we have doubled that. Let me be clear, doubled that over the time of COVID, when that decimated most staffing, right? Everybody understands the staffing issues that happened in most places during COVID. We lost staff too, and we still were able to increase the number of services provided in the county. In Pulaski County, roughly we have served since 2010 about 3,000 distinct Pulaski County residents, right? That's almost a quarter of the total census of Pulaski County. And in general, every year, that 500 people we serve is a mix of people returning for services, continuing on in needed services, and or our new admissions. So here in Pulaski County, the question always I get is, are you just serving the same people? No, in fact, 50% are new people who are seeking services for the first time at 4C Health. And in my chair, what I'm always looking for is that when people need care again, they come back. And number 2, that we're reaching more people, okay? And it's about a 50-50 split here in Pulaski County. Over 80% of the people that we serve, which is what a community mental health center was built to serve, are on Medicaid, HIP, or on Medicare. Most of our referrals are self-referred here in Pulaski County, 50%. Next 20% come from the schools, about 15% from criminal justice partners, 13% from local health care, and then 2% roughly other community agencies. 40% of who we've served is between 0 and 17 years of age, 55% of who we serve 18 to 64, and 5% 65 and plus. However, that would not include the people that we serve through the senior care program, okay, because that's the Pulaski Memorial Program. We are providing the staffing. In Pulaski County, since September of 2020, we have done over 485 mobile crisis, life-saving mobile crisis deployments, okay, for the ED or for law enforcement. And in this last year, Pulaski County residents used 178 bed days on our inpatient unit. So then what does that mean in terms of how many staff do we have in the county? Okay, well, we look at it from two ways. First is, how many people do I employ today that live in Pulaski County? Not everybody who lives in Pulaski County and who comes to work for us actually wants to work in Pulaski County, okay? When you're in mental health, sometimes you choose to work in a different county. We have 21 staff members that reside. They don't all work here, but they reside in Pulaski County. So we are paying county payroll taxes, right, relative to those staff. Now, of the people who are currently, which could be people from other counties who are working here in Pulaski County from 4C Health, but on Pulaski County's behalf, I have 6 therapists that are spread across. We have 1 full-time therapist in the school. We have several in our office. I lease one out at Braun. I lease one to Pulaski Memorial Hospital. And we just hired a soon-to-be psychologist to hopefully participate in some of the criminal justice programming that we want to continue to partner and expand upon. We have 2 nurse practitioners, not full-time, but providing services in Pulaski County. We have 19 skills trainers. These are individuals who are case managers. They might have an associate's degree, a bachelor's. They are teaching kids and adults coping skills, activities of daily living, working through family issues, and they are also the bulk of staff when I refer to those who are embedded in the schools. Those case managers, those skills trainers are in the schools. We have 2 peer recovery specialists. I have 1 recovery coach. I have 1 criminal justice liaison, which is a position we created to try to help to partner and create some ease with referrals, report tracking, et cetera. We also have a DCS liaison who participates in assuring that those referrals that come in are managed reasonably appropriately. I cannot emphasize the importance and how wonderful we feel about being on the health campus with Hospital. We feel like the move and having our location there has been good because our staff are right next to the senior care and we're located across from the hospital. And so there could be the potential for more collaboration and everything's just kind of one-stop shop, if you will. So what is the status of behavioral health workforce? 2023 data. Of the 92 counties in the state of Indiana, 90 of them are whole county mental health workforce areas. 2 counties, Lake County, Marion County, are partial workforce. Okay, so the bulk of the state has nowhere near the workforce in mental health to meet the need. And what is that need? Before COVID, you'd roughly run about 20 to 25% prevalence. You have people with a diagnosable mental health and behavioral health presentation, again, if you put it all together. During COVID, that went up to almost 50% of the population estimating at least the experience of diagnosable anxiety and depression. We're starting to back down from that, but the rates are about 30%. The workforce, the ones you're looking for, therapists, medication providers, psychiatry, psychiatric mental health practitioners, we have been, since the early 2000s, maybe even the 90s in the United States, well behind being able meet the need. The behavioral health workforce shortage isn't new, it's just magnified. So when you think about Pulaski County, in a lot of ways, there is no difference between what's happening today and the difference between the need and what is happening in all of basically the counties in the state of Indiana. And there is no state today in the United States that is able to say that they are not experiencing behavioral health workforce shortage. So I also want to address, because I think it's really, really confusing. What is the relationship between a community mental health center, county funding, federal and state Medicaid program? I'm almost done, so I promise I'm trying to talk as fast as I can, humanly possible. In 1963, the Community Mental Health Center Act was signed. It was signed by JFK. It was actually the last thing he signed before he was assassinated. And that started a system across the nation whereby counties could designate community mental health centers. In the late 60s, that funding from the feds came into this state, and that's when community mental health centers started. We have been in business, as you know, for counties since 1974. Okay, and we have been the designated community mental health center for Pulaski, Cass, Miami, and Fulton since that time. Now, the Medicaid program became a big factor in, and it started roughly about, 1965. It became a big factor in how we funded healthcare, and in particular, community mental health centers. The federal Medicaid, so states, they administer the Medicaid, but they don't make up all the rules, right? They have to ask permission from the feds. And the federal Medicaid program requires that states have a share, right? They've got to have skin in the game. So at the federal government, we'll pay portions of this, but as a state, you're going to have to also pony up. When county dollars were started, they were started as a part of the state achieving the state share. So those county dollars, right, that every county in the state of Indiana pays to their community mental health center actually is considered a part of the state share of the Medicaid program for a specific type of Medicaid program that only community mental health centers have access to, okay? It's what allows me to have 19 skills trainers and continue to build that workforce, okay? That is how that is funded. So it is really confusing because people always say, okay, well, what does this go to, right? What is these dollars? It is state law that, those dollars are paid to your designated community mental health center. It is not like IDD or developmental centers where counties have you may fund it. In law, it is you shall fund it, right? And it creates a lot of confusion. What does it go to? Why? I come to the commissioners every year to talk about what we do, because no matter what the total dollar amount is, those dollars are always a large amount for counties. In the big scheme of things, for community mental health centers across the state, all county dollars in aggregate make up roughly about 6% of the total budgets of all community mental health centers. For 4C, in aggregate from our 4 counties, it makes up less than roughly about 2% of our total budget, okay? So most of how we are funded is through the Medicaid program, okay? That is, we did not have the Medicaid program in the state, community mental health centers by and large wouldn't, okay? And so I wanted to kind of, make sure that I talked a little bit and gave you the chance to ask some questions, about that. But I know I present every year. I think it's a lot to take in. I think it's a lot to understand. And I think it's a lot to, the infrastructure between the feds, the state, the county, and a community mental health center can feel so convoluted at times. So I wanted to make sure that I also talked a little bit about that. So I'm happy to take any questions, but I wanted to be able to give you guys all the information together this evening. And then when I do my annual presentations in the future, I think I'm probably going to ask to do them at these joint meetings so that everybody can have the same information.
Well, Ken and I did send out the January 9th handout, but it was a late thought I had last night, and they didn't get it until morning probably. If they checked their computers, they would have a lot of that material that you mentioned. Comments or questions for Barry?
I guess one of the questions that I would have, because we're going through budget hearings and stuff now, and of course, every time that chunk of money comes up, 135,000, it always gets questioned, why do we do this? Why do we have to do it? What do we get back in the for it? And we also provide, mental health services, other avenues, people through the Justice Center and stuff, and they've explained what that aspect is. But I guess my question would be how, talk about partnering with like the hospital and doing stuff with the sheriff's office with mental crisis needs out in the field and all. I guess, and then you talked a little bit about, the veterans court and all. So I guess that's kind of my question. How does what you provide, and maybe the judges will have a little more input on that also, and what is provided through the other mental health assistance that we have in the county?
Sure. So you're talking about apples and oranges.
Okay.
Because what I'm talking about here is statute and code that says right through these tax levies that here, right, is the money, right? So sometimes in the past it's gone down, other times it goes up. It's all dictated by a formula in Indiana, right? That money, just like I was just explaining, is actually earmarked and works in connection with being part of the state share of what is the Medicaid rehabilitation option. That is a program that is only available to health centers, and it allows us to do things like the school-based services, the community-based services, right? To go out into people's homes and not necessarily have to, be in the clinic. It in no way, shape, or form is related to what I do, counseling, psychiatric care, or any of these other things, right? So that's really why it becomes a problem everywhere. Okay, actually, every single county. It's not even just in our catchment area, right? I mean, I've been to so many counties where the question is always, wait, what do we pay this for? What's the value? And why can't we control it? And why can't we allocate it the way that we want? All totally reasonable questions, right? But it comes down to that very specific Indiana county funding statute. It says here, this money goes to the designated community health center. So the way that we look at this, we continue to try to build. And in part then, when I come and I present, right, I'm talking about what are we building, right? Here are the services that we do. Here's the total services. We are always continuing to look to add. It is not easy. That's why I talk about behavioral health workforce. What people want is they want more therapists, right? They want people who are doing more psychiatric care. And, it is extremely difficult to recruit. And keep in mind, all other 92 counties in the state are having the exact same problem, and they're trying to recruit too, right? And then every state in the nation is having that problem, and they're recruiting. So right now in the nation, in the state, we do recruit, we hire people, but it's like borrowing from Peter to pay Paul, right? We have the same pool and we're moving them around. So we create a shortage over here to create more services over here. That's what's happening with health work. So the two funding streams, right, anything that you're allocating for anything, right, you could choose to fund a lot of different things, but they don't mix in with that Indiana statute, community mental health centers. I know that the Association of Indiana Counties has been working to try to change those things. I mean, I have, if it changes in the future, right? What I just try to do is follow, what it is that I know today, know that, we are the designated community mental health center. We continue to try our very best to build workforce. I am pretty darn proud of the workforce we have built since I first started here, roughly about 2014 is when I came to 4C here in Winnemac. I mean, right now I'm talking about at least 33 staff contributing in some way, shape, or form, even though they don't all live here in Pulaski County, the services here, right? Providing over 20,000 services. Are we perfect all the time? We're just not. Sometimes we fall on our face like anybody else does. We certainly do. But why this is set up in part two, the county funding, and I should say the designation of having a designated community mental health center in every county, is that anybody else can come and go from here, right? They can close shop, they can open shop. You have one provider that under no circumstance, like I don't get to, and I don't want it either, but I don't get to close. I don't get to leave Pulaski County. My investment has always be looking at how do I continue to bring workforce, try to sustain workforce. That's a whole other challenge. And then continue to serve where I can, right? And that's why we have looked at putting our services in lots of different places, outside of our clinic, although we have those services. And then in addition to that, really trying to expand upon what is the most easily recruitable and what we were built to provide. Most community mental health centers is the largest workforce in all community mental health centers, and that is, right, those people that I said we have about 19 of that are out in the community, and many of them.
Thank you.
Is this equation, is that probably based on population of the county as well, as far as your funding? You don't have to go through the whole equation.
Yeah,
but-
yeah. You know what I can do is, I'm sure you have it, but I can send the reference to Laura, and then it explains it there. All of that is done through LGF, right? So they're the ones that go through that. And I think it's actually more related to property taxes, not population, but don't quote me on that. I will send.
Okay, just to clarify, back to Ken's question, so you said it's not apples to oranges. The $135,000 that's mandated the state to pay you for your services, that's specifically for Medicare and what else?
Medicaid. It's for Medicaid rehabilitation option services. That's a special Medicaid program the state has that only community mental health centers are able to access and use. And RO services are for adults, right, that have certain types of diagnoses and what they call, I'm not going to get way too in the weeds, but certain levels of need, right? So there's a certain assessment that has to be done to determine, do they have such a need that, you know, not seeing them in the clinic, going out into the community to provide services more than one time.
So that money is only allocated just for that service.
That is its state share, right? Yeah.
And that is
State that we use it for, correct.
I just have a question on the nuts and bolts of the program. What is the follow-up on a client? Keep a record 2 years down the road, 3 years down the road, or whatever? Is there a stream that follows?
Well, people will enter a service. So they first come in and they get an intake, right? And so that provides an assessment of potentially what services they may need, be eligible for. Then they would be triaged out into whatever specific service with whatever particular providers, right? So some might need medication management. They might see our nurse practitioner in our office. Now, these are services that are 4C, right? Services that we have at, I think I mentioned Braun. We have, you know, the person we have at Braun, at PMH, those services are overseen by them. They just lease, right, our staff. They pay us to be. So you have the intake, you come in, and you might be doing therapy, doing medication management, you might be seeing for case management, skill building by our skills trainers. There might be some people who are seeing their recovery coach or specialist, somebody who is in recovery from substance use, which is a workforce we continue to focus on substance use services. Some people, on average, in behavioral health, and I'm saying this, I'm a licensed psychologist. The average attendance rate across the nation is 1 session, okay? When you get somebody in for 2 sessions, you're usually pretty well guaranteed that they might come back for a 3rd, 4th, 5th, okay? So the key with behavioral health is you got to get them in the intake and you got to get them in the door or second service if possible, right? And then begin to keep them engaged in whatever service it is from there. It is the treatment plan, right? The plan that gets laid out with whoever their provider is. Here's what we're tackling, and when we have completed that plan, we would discharge them. Some people might, you know, drop out of services, some might complete all the way, you know, to the recommended end within that treatment plan, but it is focused on what the individual needs are. And that's what the treatment plan for the individual dictates.
Just have one more. So, like a scenario here. You have an adult that's in your system. Then your school psychologist or whatever runs into that child that's in that home. Is there any way to connect those two situations?
Mm-hmm. Yeah. So if we are seeing an adult who, it could work both ways. We could have under the Medicaid program, not a therapist. Therapists don't go out into the homes. They might give Tela at home, but they won't go in. We don't. So for our case managers / skills trainers, they could be seeing an individual at school, and you know, they are also supposed to be going to the home, working with the parents evenings in order to continue to help that student, right? So that's the connection there. the goal is never to just chronically see, although it is hard, sometimes parents don't want us to come into their home, okay? They want their child seen at school only, but that they would be going to the home. The flip side of that is if we have somebody who is seen as an adult, and then we're going into their home or anywhere, and they say, I think my child needs services, it is more than possible to look at, what that youth may be eligible for. If somebody doesn't have a diagnosable disorder, outside of the prevention services I mentioned at school, we can't treat. Like you know what I mean? You have to have a diagnosable mental health or substance use.
I do have another question. So, just so I'm sure I understand and others understand, we provide our portion that's part of the state portion of the funding. That is just for the Medicare, Medicaid, HIP program portion of the
Yep.
service that you guys provide. Now, you provide other services through 4C other than just
Yep.
the HIP, Medicaid and Medicare program. But we're only funding that portion.
Correct.
The
Like
rest of it is-
all of the services that we do, like in the office, therapist, nurse, those are all billable. Yeah. So some of them might have Medicaid, right? But again, in the case of this is where it gets confusing. In the case of somebody comes in the office, they see a therapist, they have Medicaid. In that situation, because that's a different Medicaid program, the state pays the entire share, okay, within that federal program. In this very specific Medicaid rehabilitation option program that allows us to go home with the case manager, et cetera, that is what that's.
Any other questions, Carrie? Okay, we thank you for your time. Okay, under other business, we just have the approval and signing of the April 10th joint session and the June 12th. Motion from the commissioner.
Okay, I've reviewed those and I make a motion to approve as presented.
Moved and seconded. Any other discussion? All in favor, say aye.
Aye.
Tim, you'd like to do the same?
everybody's seen and read, and I'll entertain a motion to approve the 4/10 of 23 and the 6/12 of 2023 joint session minutes as presented. All right, I have a motion. Do I have a second? We have a motion and a second. Any further discussion? All those in favor say aye. Opposed? Passes.
Any other items of business from commissioners, council? Community comments? Motion to adjourn from the commissioners?
Yeah, I would make a motion to adjourn the meeting.
So moved.
We will adjourn our council portion of the joint session.